Hello, my name is Nurse Pauline. Thanks for watching my video today. The title of my video is Fundamentals of Nursing, Exam 4. Please hit the like button, subscribe, and share. Thank you. My question is, what is the priority Maslow of hierarchy needs? The answer is oxygen, water, nutrition. We need these for survival. What is important during our admission of patients? Answer: to obtain a patient's history and developing a nursing-patient relationship. Obtain patient's history and develop a nurse-patient relationship. We are measuring urine output for the hour from our patients. How much cc would you expect to find in your Foley bag each hour? The answer is we should have not less. We should have greater than 30 cc urine output for 1 hour. If it's less than 30 cc urine, we will notify the doctor. Lasix IV is most frequently used in the hospital, and Lasix is a loop diuretics. When your patient falls, what is most important for you to do? You will assess your patients. You notify your doctor to come to the bedside. You will do your vital signs. The doctor has to come immediately to assess your patients, maybe for fractures. And very important for the nurse to complete her incident report. For patients with foot drops, they are immobile patients. What would be your intervention for your immobile patient with foot drop? You can apply a high top sneakers while the patient is in bed. What should you do when you're flushing your tube feeding? You should flush your tube feeding before administrating your feeding. You should flush your tube feeding after administration of your feeding with water. You flush before and after with water. The doctor orders guaiac or occult stool. What are we assessing for? We are assessing, the answer is for blood in stool. What vitamin turns or mineral supplement turns stool black? The answer is iron. Urine culture and sensitivity. What are we looking for? Doctor is ordering a urine culture. We're trying to culture for bacteria. We're trying to screen patients for UTI infections. When you collect a urine CNS culture and sensitivity test, you collect your urine in a sterile cup. What is the meaning of hematuria? This means blood in urine. What is CBI? CBI is continuous bladder irrigation. This is done for patients post-operatively Male patients with prostate problems, enlarged prostates. The irrigation for CBI is usually bloody, and you have to do your irrigations until the output is pink. If it's bloody, you have to increase your irrigation, speed it up, but it's supposed to be pink. What does anuric means? Anuric means absence of urine, for example, in your patients who are on hemodialysis. The output for patients who are anuric is 100 cc the most they'll do in 24 hours. So these patients will be voiding less than 100 cc an hour. What does oliguria means? Oliguria means less than 400 cc an hour for 24 hours. Oliguria means less than 400 cc's in 24 hours. What does normal urine output be for 24 hours? For 24 hours urine, we will expect 1,000 to 2,000 ml for 24 hours. What does orange urine means? If your patient urine is orange, check your profile to see if your patients, check your med profile to see if your patients are on a medication called Peridium. If your patient is on Peridium, orange urine is expected. That is normal. If your doctor orders you to, or if a doctor orders you if a doctor orders you to strain all urines, what are we looking for? We're looking for stones, patient with gallstones, kidney stones. We're straining for the presence of stones. Immobile patients, how often do we turn and reposition them and give them some range of motion exercises? Is every 2 hours to prevent bed sores. Blood transfusion. Who are witnesses for blood transfusion? The RN are witnesses. For blood transfusion, who signs the blood transfusion? The doctor signs the blood transfusion. Heparin is ordered subcutaneously. What needle are you going to be looking for a sub-Q injection? You'll be looking for a needle 25 and 5/8 needle for your subcutaneous injections. Your patient is ordered to lie in a supine position. You will elevate the head of bed. How many degrees? The answer is 30 degrees. Patient is ordered NPO at midnight. What does this mean? Nothing by mouth, nothing to eat, nothing to drink after midnight, especially for your preoperative patients who are going to surgery or procedures. It's okay. All patients who are NPO have to have mouth care, but they do not swallow the water. Pain is the 5th vital signs. What is your patient's pain scale? Your patient's pain scale is 0 means no pain, 10 means the highest pain. you're hanging your Foley catheter on the bed. Where on the bed do you hang your Foley catheter? You'll hang it on the frame of the bed. Make sure there are no twisting of the Foley catheter. Patient's glucose is low, less than 60 cc's. Look for your doctor's orders, PRN. See if your doctor has ordered D50 syringe, dextrose 50% syringe. When you're applying mouth care for an unconscious patient, what do? Head of bed should be 30%. Semi-fowler position. The head should be turned towards you to prevent aspiration when applying mouth care for an unconscious patient. What is aspiration precautions? Precautions for patients who are at risk for choking, patients who are having difficulty swallowing. These patients may be most likely will be NPO, nothing by mouth. Patients on aspiration precaution, head of bed should be 90 degrees. Patient with dysphagia, impaired or absent gag reflex, patient with neurological disorders are on aspiration precautions. CPR. How do we perform CPR? We will consider CAB. CAB, circulation, airway, and breathing. For an adult CPR, which pulse do you assess? The carotid pulse. For assessment of pulse for an infant CPR, which pulse will you assess? The brachial pulse. When you're assessing your carotid pulse for the adult in CPR, how long should you assess this pulse? This pulse is assessed 5 seconds, no more than 10 seconds. Please hit the like button. Please subscribe. Please share this video. Thanks for watching. Stay tuned for part 5. Thank you. Have a good day.